The aorta and the arteries are the blood vessels that distribute blood throughout the body. Think of your aorta as a tube about the size of a garden hose. So an aneurysm is really a bulge in the artery. The aorta, by and large, distributes blood to what lives in the abdominal cavity: the stomach, the liver, the small intestine, the large intestine, and the kidneys. This is the abdominal aorta. These two branches here go to the kidneys. These branches here go to the legs. And the abdominal aneurysms are usually located in this section here. The problem with aneurysms is that they're silent killers. So very often one would have no idea whether they have one. They don't really have back pain, they don't have abdominal pain, they just don't know it, and sometimes the aneurysm pops and they die. The big risk is having a first-order relative who has an aneurysm: brother, sister, father, mother, son or daughter, and then high cholesterol, high blood pressure, and smoking. It's more common in men, and it's much more common in smokers. The original surgery was done in the early 50s, and it really meant putting a new piece of plumbing in. This required a big operation, and it was either an incision in the abdomen from basically the breastbone to the pubic bone, and the original surgery was basically shutting the blood flow off, clamping above and below this area, opening the aneurysm, and manually sewing in a Dacron tube which will replace the old aorta. In the old ways, people would cut this section out and put in a new graft. But then somebody had the bright idea, put a new piece of pipe in it. So what was developed were things called stent grafts, which would be inserted inside the old aneurysm, like this. So we're really relining the aneurysm with a good graft. The slang that we use is called EVAR, E-V-A-R, which stands for endovascular aneurysm repair. Endovascular means from inside the blood vessel. With this continuing evolution of aneurysm surgery, we've gone to an incision that's roughly this long, version 1, the so-called open aneurysm repair, to 2 incisions that are about this big, the stent graft or EVAR repair, the traditional type, to the totally percutaneous repair, which has 2 incisions the size of your pinky fingers. Percutaneous means through the skin. We use ultrasound to carefully scan the artery where we're going to make our punctures and make sure the puncture is just in the right place. Once we've gotten into the blood vessel and we have a wire into the aorta for our manipulations, we then use special closure devices to get into the artery, put in 4 stitches before we've done anything. And then once we've got the artery controlled with those little stitches through the skin, we can then insert our devices through these sheaths. When we take out our sheaths, we're all done fixing the aneurysm. We just have to sew the artery shut through the skin. This is a model of the incisions in the groin. And right here, you can see a hole, which is about 3/8 of an inch wide, through which we would put our devices. When we're done, we tie those stitches shut, and we're left with a little incision that can be closed with a steri-strip, little butterfly closure, and a Band-Aid. The benefits to having a stent graft, an EVAR procedure done, especially percutaneously the way we do it now, are that, number one, there's minimal, if any, discomfort, because you're talking about two incisions under 1/2 an inch. The procedure can be done under intravenous sedation or, if need be, even under local anesthesia. The other big advantage is there's virtually no blood loss. Most patients are up in a chair that evening, and the goal is to have them home 24 hours or less after surgery. In a couple of weeks to a couple of months after surgery, you can't even find these incisions anymore. I think it's kind of humorous that the patients oftentimes will go back to their referring physicians and tell them they had their aneurysm fixed, and nobody can find the scar. It's my prediction that aneurysm surgery is going to end up being an outpatient procedure. We offer very advanced techniques that are not found in other places. I think by and large, this separates MidState because personally, I take every aneurysm as a candidate for this no incision technique, this so-called Band-Aid surgery approach.